Welcome to the podcast. Today's topic will be on orthotics and sports medicine. Today I am joined by Rob Novak, an orthotist at Hanger Clinic.
Thank you.
Rob, could I have you just give a brief introduction into orthotics, maybe a few things that most people wouldn't know about orthotics?
Sure. I think the easiest thing to understand between orthotics and prosthetics in this field is orthotics is more related to providing a brace or bracing system to support a body part that is physically there. On the counterpart to that, prosthetics or to wear a prosthesis is to replace something that is missing. So in orthotics, we're going to support a limb that you currently have.
Okay. So could I just ask you then what got you into orthotics and how has that changed since you started?
So I didn't go directly into orthotics. I have a circuitous background. I started a master's program at the University of Illinois in kinesiology and studied a little bit of children's cerebral palsy and some gait movement patterns. That led me to then Children's Memorial Hospital, which is now Lurie Children's, where I actually got to do gait analysis with biomechanical gait analysis that led into surgical decision-making for the Department of Orthopedic Surgery. From there, while I was doing all this gait analysis, I was introduced to what orthotics and prosthetics were. Children came through this gait lab and they had orthotics. From there, naturally wanted to get my hands a little bit more dirty than the antiseptic environment of a gait analysis lab. So I ended up at Northwestern and got a certificate in orthotics. That's changed to this day that no longer could you be single discipline certified, either orthotics or prosthetics. Now it's a master's program in all the universities in the United States, and you end up in a master's of orthotics and prosthetics. You have both disciplines, you're dual discipline. So that's a change that's happened over the years. And then from there, I ended up most of my career at Lurie Children's Hospital, treating children with various neuromuscular dysfunction, developmental things of that nature. And from there, I ended up at Hanger Clinic, and we were an acquisition. I was formerly with Transcend Orthotics, now with Hanger Clinic, and my role there is more in the 0 to 3 population, developmental children that have dysfunction and developing normal gait patterns, and we give them bracing that allows them to have some type of development. Now, I'm still related to the neuromuscular field, neuromuscular dysfunction in children, scoliosis, things of that nature. So I'm more of a pediatric background, but the field's changed a lot. I mean, the biggest factor is that orthotics and prosthetics mainly started over in Europe and it came to the United States. So a lot of this stuff was hand-me-down, family generational things that we did things. If you look all the way back and do a history on Hanger Clinic, it was started from the Civil War. So things were metal and leather and the materials that were available to us. So in this more current generation, we've had things change from metal and leather to plastics. Now the current field is moving into this, just that we have availability of these things. These things are now available to the medical field that were once solely available to aerospace, military. Like we didn't have access to these materials. Now we're in carbon fiber. Carbon fiber is cool, but it's getting old. We're into composites now. Composite materials, multi-layered materials where instead of bracing your body and holding your body stiff and rigid in one position, we're allowing for dynamic function. They're starting to get into computer-driven products that were in prostheses, and we're trying to put them into orthotics. So stuff is evolving. And I think in one day soon, if we're into composites, I think we'll see stuff that's into like living plastics that you scratch them and they can heal themselves in a sense. There's a liquid matrix inside of it. It'll seal it off kind of like super glue, and things that would have caused a fracture or failure of material, like we're into living plastics and things of that nature. So it's pretty cool to see this stuff evolve. And with orthotics and prosthetics, most of this stuff is moving into a digital realm, right? So we took plaster cast. No, we use fiberglass. Now that's not cool anymore. Now we do digital scanning, 3D scanning. Okay, that's great. We used CAD. We would use carvers. Now we're into 3D printing. Now we're into 3D printing and using composites. Like, it's really quite incredible. So if there was something to do in the field of O&P and technology, wow, this is where it's evolved to. It's changing.
Very interesting. I didn't know that actually, that the materials that are, I mean, one could assume, right, that there would be evolution, but I didn't know that it was changing that fast. So you said composites are being used now over like carbon fiber, right?
Yeah.
So how are composites different from carbon fiber? Did you say that composites allowed for more mobility, sort of, so to speak?
So we were into plastics, right? And we were into like copolymer, polypropylene, polyethylene, things of that nature. So polypropylene is really supportive and stiff, and we could thin it out and make it lightweight, but it's brittle. If it gets really cold, such as in Chicago, and you have a kid running around in the playground in the snow and somebody were to jump on them on a sled or something like that, it can split. It'll fail because it's too cold. So just like normal stuff under cold temperatures. Carbon fiber is awesome. All right. So carbon fiber came on the scene, and we used a little bit. We would use it in prosthetics with the prosthetic socket type of a thing, but they started to put those laminated techniques into orthotic devices. Well, it's very lightweight. It was awesome. Oh my gosh, this heavy plastic brace. It's so bulky, I have to wear a bigger shoe. I could get a carbon fiber product for the right diagnosis into a regular shoe, into a dress shoe. I could hide it under clothes really well, and it was light. If you were dependent upon this product to walk and move about your day, and if you were really had a high functioning and you really walked a lot, you're on your feet for a long periods of time, you would be super tired, like pulling around and moving with a plastic larger brace. On an adult, carbon fiber got farther throughout the day without getting tired. Now, composites are nice, is that with carbon fiber, it's light, but it's really stiff. So you do normal stuff in life. You're working around the house and you trip and fall. You fall 2 rungs off of a ladder. You try to jump a stair or hop a thing, and you can crack it. If you get on like the stairs, you got to put your foot fully flat on the full step. If you catch it with your toes and then go up from that, you can split it. It doesn't want to move. Composites are nice. Now they're a blend of materials. You can use fiberglass, you could use parts carbon fiber, you can blend different plastics in it. You can mix and match materials together and then lay it up with different types of resins. You can use different resins, all these type of things. So where you want it to move, you could have a higher, like a lower coefficient of like its stiffness in there. So if I want it to bend around the ankle, I make it with materials that want to bend and make it with resins that want to flex. And then I don't want that to happen like in the top of the strut or in the calf section. So we'll make it a little bit stiffer. So if it's stiffer, we can make it lighter. It's really up to human, at this point, human creativity. So there isn't a class that you take or like, I need to know exactly how to do this. You know, material science. And I know a company in England that was 2 guys that had an idea of material science, and they were literally playing. This is kind of cool. I know about orthotics. Let's try and make some crazy stuff. Carbon's not working. We'll make it and we'll blend it with all this stuff. It worked. They sold their company to a huge company in France. Like, these 2 guys are like, we literally worked over at my house in my parents' back shed, just making stuff. So that a composite material is something that's still lightweight. It wants to bend. You won't break it as much, and you can use it in different functions. So if you don't rely, let's just say this, you're an adult, you have a lot of function, but you need a brace. Maybe you play golf. Maybe you want to run. Maybe you have some type of sporting activity you like to do, but you love the stiffness that this one brace provides you, but it doesn't work so good in a dynamic environment. You could go to a more flexible device, composite device, and do those things. And then I know people that are like, ooh, I love that brace, but by the end of the day, I go out to dinner, I'm out with my friends, I'm tired because I had fun all day doing all these things, whatever it might have been. That flexible brace isn't going to support me when I have to stand or do certain things. I'm going to switch over to a more structured material of carbon or plastic or something like that, and then I'm going to go out and do those things. So we've gotten to a point that it wasn't like one brace and you had to like live your life in it. We're now turning into having to provide you with multiple products over whatever type of lifestyle you want to have. So to me, that's how things have evolved. You could get one type of plastic and this is what it was, and I hope you can do your best with it. Now we can say you can golf with this, you can run with that, you can go to work with this, and if you want to go hike, use that. So I have a couple adults that are super highly functional, and they got like 4 devices based on whatever they're doing.
Okay, yeah, very cool. So it sounds like, though, that the composite structure material is what's best for an athlete, say, right?
It could be, right? So if you have an athlete that has most of their functionality available to them, it depends that like they don't maybe have a lot of nerve loss or neuromuscular dysfunction at the neuromuscular junction, right? So maybe not like a central nervous system dysfunction that starts at the brain. You got a high functioning individual that has maybe some peripheral like nerve issue or dysfunction, or they've blown out a tendon or a ligament and it's difficult to fix and they just don't have it back, or they won't go to surgery, things like that. You can put them in something, especially around the foot and ankle, give them the support they need, and just let them go. That the athletes, the high performing adults have demanded from our industry to change, to adapt, to find a better solution. Because they used to have to run in plastic, and that really wasn't functional, but they would try. The same thing in the military. You would use it, but you would try. Now we can get into these different types of hybrid materials, and truly, this is a wide open part of the field right now, is that if you can make it more flexible, like it's flexible when it needs to be, it's stiff when it needs to be, and if you could change that throughout the gait cycle, right, that's like the masterful thing. I need it to be loose here, I need it to be stiff there, and if you can make it drive through like the gate, the phases of the gate, you have a home run for an athletic adult.
Right. Okay. So right now, obviously, we're talking a lot about more custom orthotics, right? So
depends. It depends. A lot of these composite materials and carbon fiber can be off the shelf. They can be small, medium, and large type of a thing. So they do exist. There's manufacturers like Tuan. It's like THUASNE. They're out of France. They have over-the-counter stuff. Autobach has stuff that's over-the-counter. There's so many. There used to be like 2 companies that would provide this stuff. Now I have somebody trying to bring me a new device like weekly from a different brand and a different manufacturer. There's Allard. There's Kinetic Research. There's so many different providers. It's hard to keep up in what niche they've changed their device to make it more functional. I just had somebody come to me with carbon that's like stiff in the foot plate, but functional in the upright strut along your calf for a like rugged adult, like construction type of a thing. Those carbon fiber and laminate, like, yeah, it's not so sturdy. Like you get bumped with something, a shovel, and you fall, like rough environments, it'll break. They've made something that's the opposite, lightweight, sturdy, and stiff. Like you could go out and really perform construction in it. So It kind of really depends. It's pretty incredible. That stuff was not available like 3 years ago.
Really?
And forget it, 5 years ago.
Wow.
Like there was like a couple manufacturers. It's incredible.
Yeah. So the fact that, I mean, they already have retail stuff out in stores is, yeah, that's pretty
You would
cool.
need to come. Most of this stuff isn't like direct sales type of a thing. Like you can go pick it up on Amazon, but who knows? Maybe you can do that. Or no, I wouldn't do that, but you could do something like you got to self-diagnose yourself.
Okay.
But anyway, you come to one of us. Now, the other part is that we can get into custom work with this stuff, and that's really cool. Okay, now you have somebody with like a greater need in their support of their limb or the body part. So maybe we're outside of the foot and ankle and we have some kind of deformity or weakness, and we're talking about the knee and the hip, right? So we don't have a lot of balance and control. You're trying to control multiple segments of the body. Now we can start to use, again, a blend of materials. So that manufacturer that is doing composites bought those guys that were making stuff out of a shed, and they said, look, we need your composites to apply to this bigger category of custom. Your job is to do what you did well and now take it to the next level. And now we're doing custom orthotics that are like composite materials. Carbon up here, struts through metal here, a blend of metals and plastics and composites. It's truly like an artist's dream come true. If you can dream this and you want to create, it's part science, it's part engineering, it's part literally your creativity in artistry to develop something to help the human body move better.
Very cool. So I'm curious then, so if you did have an athlete with an injury, obviously it sounds like it really more depends on what injury they have, or like what kind of injury they have, whether it's neuromuscular or like central nervous system, like whatever related. If they were to come to you, like what would you recommend, right? So because like, would you recommend them a custom orthotic, something more like in that region, or something off the shelf kind of?
So
What would your advice be to them?
Let's say we have a high functioning person coming in and they're injured and they're in the rehabilitative state, and we can like throw out neuromuscular stuff and all this other stuff. You're injured. I'm in the recovery phase. I'm almost there, but like, look, I don't have a lot of strength in my dorsiflexors. I'm having a hard time clearing my foot. I'm almost there. It's just taking a long time. I'm working through like stiffness in like my ankle joint. I don't have my subtalar joint moving as well. Like we're working on it. Just I'm almost there, but I'm having difficulty. I trip. By the end of the day, I trip more because I'm tired. That would probably, barring that the anatomy looks as we would expect it to be, you can start to like pull yourself out of the custom work. Then I could do something that's over the counter. It can be small, medium, or large. We may use a shoe insert, a foot orthotic. We can, if we worried about like subtalar joint motion, I can use an insert to stabilize the foot around the subtalar joint and marry it with carbon AFO to help you in the sagittal plane to clear your foot. That type of a thing. So that would be my reasoning. And those people come in all the time. Okay. Car accident. I got hurt at the health club. That was this week. Sports injuries, having fun. Like I'm not 18 anymore and I go and do stuff that I shouldn't be doing anymore at 49 and I'm getting hurt and I'm going to be in all this stuff and I put myself in back braces and all kinds of stuff. So if your anatomy is there and you're in the rehabilitative phase and you need some support to get you through, it's usually over the counter. Now, sidebar with that stuff that could be injury in athletes, and we have a more like catastrophic type of injury, and we're talking about a change in what we would expect to be normal anatomy. The off-the-shelf fits, but it doesn't really fit in total contact with your body. I'm worried about soft tissue injury because you use it. Now we have to go into custom. I need to scan your limb. I need to cast your limb. I need to measure your limb. We need to construct, let the artist's mind start to come into play more, that I need to create something that stabilizes you, protects your body while you use it, and gives you the greatest amount of functionality with it, right? You're hurt. I give you this big old brace. It did a great job making your foot and ankle not move, but you hate it because it's a bear to put on. And you got to lug it around all day. And I really don't love it because it's too much for me. We can get something in that's super dialed into you, gives you enough support, and lets you get to be where you want to be throughout the day. So custom is more when I have to work around your anatomy, or small, medium, large isn't providing like triplanar control of your body. I need something more than clearing your foot in the sagittal plane. I got coronal and transverse plane things going on at your foot and ankle. I might need to use an insert. I might have to say, I'd love to give you those things, but with your deformity, I need to control 3 planes of motion. Sagittal, coronal, transverse. I'm going to have to put you back into something that's more conventional to hold you into place, to give you the support you need, protect your skin, and allow you to function. Keep healing. Perhaps that healing is like this was traumatic and you were in a cast and they were in surgery and we're working yourself back. You can start there and finish somewhere else. Or just like my people that are in between braces. Look, I got to wear this thing all day long. I don't love it, but I have to wear it, and this is what it works. But I can still hike, walk with my wife, walk the dog. I just don't want to walk the dog lugging this thing around. But if I wear this, I know it's not great, but I can do it. We give them something of a choice like that. So it depends. It's about listening. I need to know what you need to do and what you can't do, and then try and find you something that works better to get you there. The patient that's had a lot of those things is sort of easier to work with because they've tried a lot of options, and we know what to stay away from and what to move towards, that type of a thing. Okay. Again, you got to use your artistic, creative mind to get where you want to be for whatever the patient may come in with.
Okay. Yeah. But so it sounds more like you would use something more custom if the injury's more complex, or it's like, yeah, there's more to it than just you're almost done with rehab or whatnot.
Absolutely. Just if you have a lot of function left in the body, you have not a lot of perhaps pain or complicated medical history, you can start to string yourself out of the complexity of the design. If you have complexity of patient and complexity of medical history, now I can go down both tangents here. You're usually ending up in something that's more custom, created and delivered to the patient and their needs that have complexity to it, and even throw complexity into anatomy. Sometimes I have people that want complexity, like I need help from head to toe. I need spine, hips, and legs type of a thing. And what I can deliver to them is something that extensive, but I know they don't have the means to continue with it. They're not set up with the rest of their medical team. They have not a lot of contact with their doctors. They don't have a good rehabilitative team. I need physical therapists involved. I need trainers involved. I need them to work with that complex device. So I could give them something super custom, but if they don't have the network around them to be successful, I will come down to something simpler.
Mm-hmm. Okay, I got you. Right. So a lot of what you're talking about, though, thus far is like post-injury.
Most of it's post-injury, post something.
Would you ever use anything preventative? Because I know a lot of, especially athletes, will wear braces and whatnot, sort of preventatively, so to speak.
I would say usually not the uninjured athlete. and then get something to be preventative, it's usually that something has come about or had come about and was healed, but we don't like their biomechanical motion of their body. And you are dialed in at some type of athletic performance that's greater than the norm, because you're surrounded by an athletic trainer, you're surrounded by a coach, you have performance people involved, you have strength people involved, you have a network that's trying to get you somewhere. If these experts see you with some kind of like biomechanical disadvantage and you've been hurt before, or what you do in your athletic activity may tend to lead you there, then we might step in and do something like prophylactically, like preventatively, and I've done that. So sometimes when I have a better network, we do something like that, and it is around the foot and ankle. That's one of the, okay, so two parts to that. I'll give you foot and ankle. We can do some custom and non-custom inserts, just depending what's going on, and I've done it for football players. That's where it's been. Or two, in the same vein that you have like an offensive or defensive lineman, and they're now stuck into like functional knee braces that are more in the framed network type of a thing, so they don't end up with a major knee injury type of a thing. That makes sense. That's orthotic work. That's totally using a brace to support a body part. You can totally do that preventatively to support it, right? So that makes sense. That line of idea, and it makes sense. Now, I know that, but that's not usually where my mind goes. I'm more in the medical clinical stuff, but in the athletic stuff, it's totally there. It exists. Just watch a football game, watch a professional football game. And perhaps if you're lucky, you may see something fall out of their shoe where it's an insert. So sidebar on that. There was a product that was developed out of South Bend and with an orthopedic surgeon and the Notre Dame football team. Okay. If you had an ankle injury during the game, the person would come out, the shoe would come off, various maybe clothing or socks may come off, and they would have to like tape your ankle up real fast, put you in, and then you might have missed a series if you were lucky, but maybe 2 series, and then you were finally ready to go back in. He has developed, along with some orthotists, like a boot.
Yeah.
In a sense, like a size 13, a size 12, an 11, a 15, a 19, right? Some of these guys have huge feet. This boot can instantly be put around the cleat. It can be put around the cleat on the back, like posteriorly up from the plantar aspect of the thing, and they can tape over it really, really fast. They maybe miss a couple of plays. They're at best, at worst, out for a series, but in a couple of plays, or if there's a first down, that person can go back in if they're not really, really hurt. So there is some stuff that they use, 1, preventatively, knee braces, 2, mild acute injury during the game that we've changed our way of thinking. And then, yeah, we could do stuff in the feet that's like preventative from that. And I don't know, you could think of in the same vein, I'm talking about these more high profile things. Think about bowling. There's wrist guards that hold and support the wrist with the bowlers. Technically, you could call that an orthosis. It's a wrist hand orthosis. So same type of a thing. Again, using it perhaps preventatively, that you don't have wrist strain and tendon ligament type injuries, stuff like that, but control in that nature. So yeah, you could use orthotics preventatively in higher functioning athletes.
Out of curiosity though, do you know what like if that was like a research thing though, that from South Bend, the orthotic for the foot, or was that kind of just
the physician is Dr. Furlick. He was the orthopedic surgeon for the team, and I think it was just a collaboration amongst like athletic trainers and physician and coaching. Hey, we know that this happens. Can't we do something better? You guys are doing a great job. There's nothing wrong with what's happening here, but like that person's not really fully injured and out of the game, but you guys getting to this person, it's wet out. Oh my gosh, it's raining, and you want to tape the ankle and get the person back in. It's muddy, and you have to use mud, wet, and tape, even though it's like heavy duty medical athletic tape. It doesn't stick. It falls apart. They're working fast under like, come on, I want to go back in. Somebody's on you. Like, it's just not working well. I think it came out of what could we do better? How could we create something that could get us, that we didn't have to disassemble an athlete and reassemble them, right? Leave everything on, just go over it and keep going. So at TV timeouts, quarters, halftime, stuff like that, then maybe the device could come off and you could get somebody in with like a more intimate, like tape and control, like at the joint surface type of a thing. Is there research behind it? I would suspect, but I'm going to tell you that it was probably trial and error. And they found out that there was very little error except in concept and design. And I know the design got tweaked a little bit. Like there was different iterations, like, you guys made this, man, but it breaks. Hey, you guys, you put this thing over here, it breaks too. There was iterations of stability and fit. And that would be your research of it. But it wasn't like, hey, we used this at Notre Dame and we used it over here and we used it over there. And the only research was like after the fact type of a thing. Like, look, I had a guy come out of the game and he was out 2 series. Now I have a guy out, he's out 2 plays. That is what they judged it on. And then they didn't have, in terms of the orthopedic surgeon, you didn't have like reoccurrence or failure or a greater injury, that you had somebody continue with what they were doing. I don't know. I didn't dig it up. You're going to have to dig.
No, I mean, it's cool. It's a cool concept, especially in pro sports. Like, like especially in sport or pro sports, that the athletic trainers, the athletes, they all want to get the athlete back on the field as fast as possible. The only concerning thing about that boot is that, you know, if they're injured and you don't like assess it more than what it is, you just kind of assume it's a sprained ankle and you put that boot back on, and you know, you put it back on and they actually ended up having a fibular fracture or something like that. That's the only thing that was kind of my idea. That's kind of why I wanted to know if there was any more research on it or anything, but you know,
I think they probably have an idea of who it goes to and who it doesn't when they're using that device. It's called TAYCO, TAYCO. I'm sure you could find it, but you're right. It's about assessment of your patient, assessment of the athlete and the situation that it involved in, right? So if this person went way down and came out, I think it's more related, like they stepped on somebody else's shoe and you kind of got you kind of understand, you hope that the person understands that they're not really hurt and they just need some stability to like keep going, that type of a thing. So I think it's definitely not for everybody. Just along the way your mind's thinking about it is actually totally right.
Okay, so I know we've been talking a lot about like using orthotics for injured patients, but what about healthy patients? Should they use them? Should they not? Preventatively, so to speak.
So I have runners that come to us. The runners who had been previously injured love their orthotics preventatively, right? So we're talking about the runners that go in and buy like 5 pairs of the shoe in the run that's like the run of materials that's most comfortable to them. Like, I'm due for a new pair of shoes. I went out and I tried this brand and this model, and I'm like, whoa, I feel great. I usually buy this one, but I don't know why this model this year feels great. Well, the materials and all the stuff are like just the right recipe. And they'll go buy 5 boxes of those, 5 pairs. They're also usually the person that wears orthotics because they were once hurt before. Plantar fasciitis, they did twist their ankle, they have met pain, they have any number of like foot diagnoses and they're hurt, and they never want that to come back because they never want to stop running. 100% will use an orthotic, whether they need it or not, or what they just I need my orthotics to go, my foot orthotics go in my shoes, and I run and I don't end up injured. So it's part 100% psychological and a mind control thing. Even if I'm assessing this person, they have like no biomechanical dysfunction. Like the foot and ankle looks good, their strength is there. There's nothing wrong with like the soft tissue of their foot, like the fat pads under their heel. The Mets are good. They don't have anything going on with their sesamoids. Like tendon function's fine. They have nothing that's really going on, but they know that perhaps if they run without it, that issue kind of creeps back in. 100% using it in a sense preventatively. And then there's some people like I had treated a doctor, surgeon, and he had posterior tibialis dysfunction. His foot was not coming out of pronation. It was stuck in like pes valgus. They wanted him to, his colleagues said, oh, that's like really in bad shape, man. You're going to need more bracing and more plastic to hold you. And I'm like, come over here. If you use that, it will work, but you will not want to run on it. You will come in here and just take me out and say, don't even know what I'm talking about. We might use an insert. We might customize it and have it with wedging, posting, tipping, so I can take your heel out of valgus and shift it more towards neutral, and I get you in an operational range of motion that doesn't cross your threshold of pain, that doesn't take you to the end limits of your valgus, and you can run on it, and I keep the skin happy. That's 100% preventative, but it's also related to, like, that person can walk around with that. They don't have pain. They can do their whole life. If your foot's in a bad position, but man, he can't run on that because it's going to hurt. That's what I would use an insert 100% preventatively to keep that guy or that person out of pain, not crossing their threshold of pain, and they're totally fine, either normal anatomy or not. So yeah, you can do it preventatively from that standpoint.
Okay. But I mean, would you consider that doctor a healthy patient? Like, I feel
100% healthy guy, just blew out his post tip.
Yeah. No, yeah, I was just kind of curious more about the healthy athlete, just because so many people or athletes use it.
So you could do that. Think about somebody that you see, a healthy individual, right? No pain, no injury, never had it coming their way. You might go to a store and be fit with a shoe, and you could use like shoes that have what they might have like neutral posting. It has neutral cushion throughout it. Or you could get something that they might call like an anti-pronator or an anti-supinator, right? We can change the materials throughout the shoe to shift the position and keep you out of that. If that doesn't control it, we can go up a level and get the intimacy of an orthotic device touching your body part and moving it into a better biomechanical position with the structure of a shoe around it. 100% healthy preventative thing, right? Like your clothes, or they might have say like, I'm running on this and I can't really go do the mileage that I wanted to do, or I tried to do this and I'm kind of hurt, or it's like starting to get achy. I can't find the right shoe. Sometimes you got to marry that stuff together.
So what about
Think about Dr. Scholl's. They weren't smart. They put the kiosk in the store.
Previous injury, and they come back and they get a bunch of orthotics. Don't you think though that if they're completely healthy, so like the doctor, you said he had some posterior tib stuff, but someone who's like no pronation, no supination, has pretty much full neuromuscular control, but they want to use a brace because maybe they've had previous injuries before. Don't you think that maybe that could affect maybe their proprioception, like they're kind of, and then without it, they could be at higher risk for re-injury?
For sure. If you know that, think about that person that has, or they didn't rehab right, or they just, people's nervous systems work different. Like there's a pretty broad definition of what is normal function, right? So You can have somebody that doesn't quite have the agility and the ability to sense where their joints are in space. Could you use it prophylactically to prevent an injury? 100%. So let's just put it this way. If I saw one of my kids moving in a way in athletic function, no injury, totally neuromuscularly intact, no previous injury, and I'm just watching some bad things happen biomechanically, would I give one of my kids something to possibly prevent an injury or a greater injury if it were to occur through that biomechanical disadvantage they're in? 100%. I'd do it.
Okay. Right. But you would maybe want to address that biomechanical deficiency, right? So like maybe pair it with orthotics, but try to correct it maybe as well with rehab or whatnot.
100%. Yep.
Yeah.
So the orthotic prosthetic world is one that really doesn't live in isolation. We work together with someone else.
Okay.
Our best results when you have a quote a thing from an orthotist or a prosthetist, at some time it's best married together with some type of person in the rehabilitative field, a PT, an OT, a trainer. Somebody is connected to having that person work better with their body and the thing that's on it. That's where like the greatest success is. It has to be complementary medical intervention on a person than like a Band-Aid thing. Here's your thing, wear it, you'll be good. I just had that conversation with somebody. I can give you this product, but you will only have success if you're working with someone else with it. If you, it was a mom who wanted to do something preventatively for their child. And I said, this isn't a device that I give you as a Band-Aid in that you wear it for 3 months and this thing that you see goes away. You have to use it and then use it with someone else. And your line of thinking with that is spot on. You have to marry orthotics with other healthcare providers.
Okay. My one other thing I was thinking of is could orthotics be contraindicated in any sense, like with any for pathology or whatnot? I don't.
Yeah, 100%. So just think about your football player example.
Yeah.
That boot and tape would be contraindicated with somebody with a greater injury or wasn't disclosing this greater injury, but wanted to get back in because they knew that 6 scouts were in there, and there was a part of proving toughness to get it done, or this person knows they were dominating their position at the time, and I have to get back in there and we'll fix this tomorrow. That would be a contraindication. And to me, in my same example with the parent and giving them a product without healthcare intervention was, to me, that device was contraindicated. It could, the device was indicated for the problem that presented to me, but it was contraindicated in the fact that I wasn't going to have success with it. So if I wanted to just sell somebody a thing, that's the realm I was in. So to me, because they didn't have the right support system in place, the device was contraindicated. And then I can have just diagnosis contraindication. You cannot use this with that. If you use it, like if you use this with that, you'll be hurt. If you use this with that, like greater medical problems could happen. All right. So just think about like head injuries or swelling or shunts or certain things going on and something I might put around your head. A helmet, a neck brace, things of that nature. Unstable fracture of the neck. And somebody says, you should just wear this cervical collar and you're going to heal. Like, yeah, that's contraindicated. Or I have a spinal injury and you have like ligament injury around it. Like you have some type of like forward flexion moment or something that involves like whiplash or a pull. And you have like your anterior longitudinal ligament of your spine, it's damaged and it's weak or it's compromised. And somebody said, just put a back brace on. We'll get this spine to heal. If I have to change the alignment of your spine due to your injury to get the healing of the bones and the vertebrae because they're under a compression fracture, or I need to do something that needs to extend your spine and you have a ligament injury on it, like, man, that's going to be really, really bad. So you can absolutely have contraindication for all those reasons: mechanical, medical, things going on with your body that could lead to greater medical problem, lack of help from my colleagues that have complementary aspects of the rehabilitative process, right? Like some of these things only work if you have a PT. Like think of your proprioception.
Mm-hmm.
I'm kind of hurt. I want this thing, and give me this thing, and I'm going to go figure it out on my own. Like that's a bad recipe for success. Like I'm going to give you this. You're going to work to get stronger to realize where your proprioception could be. Mm-hmm. It's here, but we would like it to be better so you aren't injured. Or I don't like where your biomechanical disadvantages of your body is. We need to work to improve that. You need to have biofeedback. You need to see it and watch where you need to be to understand where you want that joint and space to be preventative. I need that to happen. If I just give you the thing, it doesn't mean you're going to have success. So I could call that as a contraindication too.
Yeah, no, and that's tough sometimes too. I feel like so it depends on where you work at as an AT, because we're opening up to a lot more different areas of where an AT can work at now. But I'm thinking for like, say, a high school setting, sometimes high schoolers just don't really, do their rehab. They're not very involved. They don't really see the value in it a lot of the times. So I feel like that might be a challenge for an AT working in that setting, to make sure that they're, going and getting the proper rehab instead of just going and getting a brace and whatnot.
Yep, I agree with you 100%. I've seen both sides of that. One, I lived through it. Two, like I've seen people come up to us, and back when I was in my hospital days and they would come through non-operative orthopedics, they were literally there to get like a clean bill of health, make sure it wasn't something more catastrophic. Hurry up, get that guy in here with the brace so I can have the thing, so I can go back and have my son or my daughter do this. Mm-hmm. They're being scouted in tennis. I've heard it all. Scouted in tennis, scouted in basketball, scouted in wrestling, and everything. Mm-hmm. And not paying attention to the rehabilitative process. I remember my wrestler had a foot injury, and we had him either in like a boot or an orthotic or a carbon foot plate in the shoe, something. And the orthopedic surgeon said, you're going to have to heal from here with this. But if you don't, and you go back to doing what you were doing or thinking that you're not really hurt, you will fully fracture this and you will go to surgery. Didn't listen. Thought he was fine. It was just not as big as what he was. He thought the doctor was scaring him. Guess who I saw a little while later needing more stuff? The guy who had screws in his foot. I've seen all of it, from not taking advice, not doing the rehabilitative process. Give me the thing so I can go back. I'm not really hurt as much as I am, to you should heal and recover and you will be just like you were before. But if you don't, worse things will happen. And usually it was around the spine. You have a spine injury, please rest. You have a compression fracture. It isn't something that requires surgery, but we could give you a brace, or you should, like, there's research on this, like rest and rehabilitation will absolutely heal the fracture. You don't need a brace guard or anything like that. Mm-hmm. But if you don't listen to us, and I had this dad, well, it'll be okay. You're not really broken. He'll retrieve all the baskets. So all the balls that come through the basket, he'll feed them back to the shooters. And I'm like, that is not the right idea. This is literally healed by rest. And if you want to put that stress on the back, you'll see my friend, the surgeon. So that that is a difficult environment to live in. I've lived it, and it's for exactly the reasons that you described. Lack of knowledge, and lack of knowledge from the patient perspective, who's a teenager, the parent's perspective, that their aspirations for their child to do whatever it is they want them to do and to be successful in, and not to be surpassed by the next person up, just like we hear on TV all day long. That lack of knowledge and getting that person that's not really like surgically hurt back in to activity again could lead to a problem. So I found the greatest success for all those people, again, in the same space doing those things, is conveying compassionately knowledge so they understand what their decision should be for success.
Yeah. I mean, our health should be the most important thing, but sometimes
Look at us human beings, huh?
Right. Well, thank you, Rob, for joining the podcast on orthotics in sports medicine. It was a pleasure having you. I've definitely learned a lot today. Lots of different perspectives and viewpoints of things I didn't even think about. But so thank you for joining me.
You bet. It was a pleasure being here. Thanks for reaching out.
Cool. Yeah, of course.